Hello and welcome to this week's CEO Weekly blog. We've had some great feedback on the segments we've been presenting over the last several weeks, and hopefully you've had a chance to tune into a few of them along the way. Last week we introduced the idea of gratitude and the impact it can have on our lives, and hopefully you're taking a chance to reflect on that and maybe even reach out a little bit to people in your circle of influence to express your feelings of appreciation for a particular act that they've done or skill or talent or gift that they've shared with you. But today I want to talk a little bit more about some of the work we're doing around the Pullman Regional Hospital Foundation and their role in Community Health 2020 and how that can continue to roll out and play a part in our goals to be a self-sustaining, self-determining healthcare community for the region. I want to talk about the Endowment for Quality and Access. Now, most of you understand what an endowment is, and what we're doing is we're in the process of raising money to put aside in an endowment that assures that our community can enjoy quality care and access to needed services. And we've got 5 areas that we're focusing on. The first is we want to make sure that as healthcare changes, we have the financial support to be able to assure that the community has access to emergency specialty care, whether that's orthopedic care or urology care or general surgery care, maybe even access to emergency pediatric care. These are all things that Pullman Regional Hospital now uses the resources that we have to make sure that the community has access to those, but we don't really collect any money for it. There's not extra payments that we receive from insurance companies or the government to do that. So it's a cost that we feel is important to us, but as financing changes in healthcare, we may be forced to make decisions that could eliminate some of those services if we don't have an alternative form of funding. Same with routine. The second area of focus is routine care, whether that's pediatrics or anesthesia or general surgery. These are things that we also provide financial support to, but we don't receive extra payment to do it in order to make those services available to the community. It's important to us in the third category that we continue to focus on quality hospital care. We want to make sure that the level of care that's offered in the hospital remains at a high level. That requires education for staff. It requires the commitment of a full-time hospitalist service. It requires that we implement protocols and procedures that are evidence-based and a part of the growing body of knowledge around how to improve health. And to do that requires resources that we have to invest to make sure that we have those services available and provide care at that level of quality. And when resources become scarce, organizations can be forced to have to cut corners on some of those things or eliminate them from what we do, and we don't feel that that's in the best interest of our community. We're committed in the fourth area to physician excellence and physician leadership, recruitment of physicians, our physician leadership group, the role of a chief medical officer in helping to bring together physicians to make progress in how we provide care and identify those areas of the community that lack in certain services. And so the fourth area of physician leadership and excellence is also a part of our Endowment for Quality and Access. And finally, our fifth area of focus is around a quality hospital experience for the patient and for the family. We get great recognition for this, and we've made commitments that make this possible in how we staff and how we organize and how we respect the commitments of our staff in determining their role in the hospital and in the interactions they have with the patients. We want to preserve and strengthen that as we continue forward. And as resources become scarce, we may be forced to have to look at that unless we have alternate sources of funding. So there you have it, the Endowment for Quality and Access, 5 areas of focus that will help us continue to provide a high level of quality for our community and region for many years to come. Thank you for tuning in to this week's blog, and I hope you choose to have a great day.